Hi and welcome back to the channel. My name is Jennifer, your Medicare and retirement guide, and today we're doing the internet's most searched questions in regards to knowing your rights when you're switching plans, whether it be during AEP, OEP. So remember, as always, I have plenty of YouTube videos for you to go ahead and do a deep dive into any part of our healthcare system. If you like this content, consider sharing it, like and subscribe, and comment down below on what new topics you want me to cover next. Other than that, let's get started into the most asked questions in regards to switching your plans and what you should know your rights are when doing so. So the first thing we have to talk about is special enrollment periods. So as we talked about before on this channel, there is annual enrollment period every single year, October 15th to December 7th, where it's a free-for-all. You can change your plan, review it, switch from Medicare Advantage to Medicare Supplement, disenroll entirely to just be on Medicare straight fee-for-service A and B, and go ahead and review my prescription drug plan benefits, and doing all these switcheroos, right, during those 2 months. My busiest 2 months personally, but it's great. It's good to know what plans are coming up for the following year. Every company releases a new set of plans, maybe discontinuing some of those plans, and they send you that letter in the mail saying, hey, we're no longer going to support this plan, you have to switch, or make sure you reach out to your agent because your benefits may be being reduced on your plan. So it's really important that every year you go ahead and double check to make sure that everything is going okay with your plan. But let's say, you move or something occurs and you need to switch your plan outside of that annual enrollment period. So those are usually typically known as special enrollment periods, or SEP, that happens outside of the year. So what are things that you should know are your patient rights? So the first thing I want to cover is continuity of care. So continuity of care is when you have a plan in place because you are going through an illness, or you're in the middle of a treatment. So some things that you want to keep in mind, that if you switch your plan mid-year or during some of these special periods of your physiological lifetime, that you understand what are your rights. And the 12-month continuity of care is something that could be granted to you, especially if you're switching from like a different medical group or a different insurance plan. So if a provider is terminated, for example, from the plan network, and you're going active treatment, CMS does require that the plan continues covering that provider for at least up to 90 days, and in some states, depending the state you are in, up to 12 months, especially if you have a doctor who is no longer part of that medical group or no longer takes that insurance. So just make sure that any of those situations occur, you make sure that you go ahead, ask your doctor, hey, where are you moving to, and can I still be seen by you through this plan, and reach out to the plan and let them know, like, hey, I already have a continuity of care plan with this provider. I need to stick with this provider at least for 90 days or 12 months, depending on the severity of the plan that you are on. I'll use California, for example. California, in my home state, we have continuity of care for 12 months, even if the provider is in or out of the network in the new plan. So at least if you're, a California resident, you do have that right to keep seeing that provider for up to 12 months, regardless if you switch plan and or provider. You just need to make sure you let your doctor know so they can go ahead and put in the referral and make sure that you have authorization from the medical group to go ahead and continue seeing that provider. There's also something known as transition of care. So what do you have to know when you're in the transition of care? So remember, we were talking about, the potential of like terminal illness or a chronic condition, and or you maybe had surgery and you still need to see that doctor, for your follow-ups. So this is known as the active course of treatment. So if you are in an active course of treatment, there are rights that you have. So you can go to your provider and they must agree to accept the plan's terms if you switch plans and or medical groups. And that, again, you go to your primary care, especially if you're in a Medicare Advantage plan and you're on an HMO plan, you go to your primary care provider, you let them know, like, this is the specialist I am seeing. They're not in my network, but I would like to see them because they are the ones who perform the surgery on me. They will go ahead ahead, submit that referral. They will put that justification in the referral saying this is for continuity of care. They receive the service, the surgery from this particular provider. They're not in our medical group. They do have the right to go ahead and see this provider, like I said, 90 days to 12 months, so that you can still keep going with your transition of care. So the next topic I want to talk about is the transition supply for prescriptions. So this is always a really big one for drug coverage, right? This is Medicare Part D. So clients are allowed a 30-day temporary supply of drugs they're taking, even if the new plan doesn't cover them or requires prior authorization. Again, know your rights. If you switch your plan and you know that the medication you're taking needs prior authorization, you need to get a new referral and new authorization number to get that prescription, let your doctor know, let your pharmacy know, like, I switched plans. I need a 30-day supply because my doctor just put in the referral into the system and I'm waiting for authorization. So you can get a 30-day temporary supply in the meantime as you're transitioning into your new drug plan. So make sure you keep in mind, when you're transitioning, that this is going to be the responsibility of you, the beneficiary, to be on top of this. This is not going to be seamless in terms of, oh, my doctor's going to let my pharmacy know and they're going to know to go ahead and put in the new referral and I'm going to get this authorization. No, you have to play an active role in this as well and let them know, like, hey, this is what I did. This is my new member number for my Part D or my new Medicare Advantage plan. These are the medications that I'm on. Can you make sure that all of these are still good to go, or will I need new referrals for these medications? Can you please let the pharmacy know so I can get my 30-day supply in the meantime while we get this authorization? So again, those are kind of things that, you as the beneficiary, you are responsible for. I wish our system was coordinated enough to do this without you needing to lift a finger, but who knows? Maybe AI is going to do it for you in the future and you don't have to worry about this no more. But in the meantime, you are still responsible for it. You have to let people know. They cannot read your mind. They have no idea what you do in your private life until AI does. But until then, you need to let people know what's going on. So the next section I would like to cover is the right to appeal or request exceptions. So one of the things that I usually let my clients know, especially in terms of the medication world, is the RX exemption form that your provider can fill out in the event that your medication doesn't fall into a tier with your new Medicare Advantage and or prescription drug plan. So what does that mean? So every company has a formulary. Your medication will fall into whatever tier that company deems that medication to fall under, whatever tier they deem necessary. Some medication is not even in the formulary. So when you go into a new plan, make sure you let your doctor know, like, hey, I know this drug is not in the formulary. Can you write an exemption form for this to justify with my current condition that I do need this drug in order to function? So your doctor is able to do that. You can also file an appeal and request for a coverage exemption directly with the insurance company. That one takes a little longer. That's why I usually let most clients know to talk to their primary care physician for that exemption form, because that to me is a little bit quicker and you're having the second opinion of a doctor, right? Like, you have your doctor actually going and advocating for you, which should help the process move a little quicker. The last thing I'm going to mention is access to medically necessary services. So Medicare Advantage plans are required to provide all medical necessary services that original Medicare covers. Medicare Advantage is A plus B plus D equals C. So everything that traditional Medicare covers, Medicare Advantage must cover. If the new plan tries to deny you coverage, you can always appeal. You can always appeal, and you can always ask your doctor to go ahead and help you with that appeals process as well, or a trusted agent to go ahead and fill out that paperwork and put that in, because it is the responsibility of that insurance plan to comply with the contract that you signed up for. But make sure you read what you sign up for. Other than that, this has been Clients' Rights when switching plans mid-year. So if you like this kind of content, please feel free to like, subscribe below, comment on what you would like to see next. And as always, whenever you're ready, I would love to review your benefits. So click on my link down below so I can go ahead and review that for you. Other than that, wishing you a happy, healthy day, and I'll see you on the next one.